So I'm going to talk to you guys about my experience as a travel nurse and being a local travel nurse. So when I was a local travel nurse, I took my first assignment in a PCU. So a PCU is a progressive care unit, which is different from an ICU because a PCU, or also known as intermediate care, is going to be a less level of care. Not that they're any less in terms of their specialty or anything like that, but the level of care of the patient's different. So in the ICU, we're typically taking care of very sick critical patients, and it's usually just 2 patients. But their ICU at the location that I went to had been overfilled with staff and travelers. I wanted to get into traveling, and I wanted to open my eyes to a different level of care, because on the floor just typically means outside the ICU, and that is going to be taking care of patients of 3, 4, 5, 7, 8 patients at times. And that's drastically different from an ICU. It's a different skill set, and it's a different mindset also. A lot of ICU nurses just can't do it. They would never go back to their med-surg days, and a med-surg nurse would never go to the ICU, which is fine, and that's a very respectable thing, because we just need to realize that our levels of care are different, but no one is more or less than any other person. During my time in this PCU, I got to experience a lot, learn a lot. And one thing that I did there was I was like, how can I utilize my ICU skills to help out these people? I learned that there's a bunch of ultrasound machines in the hospital, one in the ED, one on the floor, and one in the ICU. So I would go grab one and then just go and help people when they needed IVs. Eventually what happened was the whole hospital knew that I could do ultrasound, and there wasn't really an ultrasound person overnight. So people would just call me randomly or message me through our little secure chat on our Epic and would be like, hey, can you come do an IV? And I'd more than gladly go and help them. So then for my second contract, I went to a critical care float pool as a travel nurse. So the expectation there as a critical care nurse, as staff, is, you're going to float to all these different ICUs. They have a MICU, which is medical ICU, a surgical ICU, a cardiovascular ICU, neuro ICU, and then a cancer ICU. And it was very nice being able to float through these different units, but as a travel nurse, you're expected to be very competent. So you could go to a surgical ICU and get, a post-op BKA, and maybe you've never had that. They have different types of drips, and even the procedures are a little bit different there too. And then the next day you're going to the cardiovascular ICU, and you might have a patient who just got out of a big major surgery, who has tubes everywhere and a lot of drips. So it was a very exciting time. But one thing I want to talk to you guys honestly about is about reading your contracts, because there might be a time where you're in a situation where you don't like what's going on at that facility, and it's important that you read through stuff, because if you understand your contract, you understand the flexibility of what you can and can't negotiate. Things that are typically not on contracts but are a thing is floating. So being floated to another unit because the unit that you're typically hired on as a travel nurse isn't needing you for that night. But let's say if you are being floated to a place that isn't being respectful of you, or maybe you're not feeling fulfilled in your role, or maybe that's not what you signed up for, and you understand your contract, talking to your recruiter and being honest with them about that situation is a way for you to easily and safely get out of a contract. Because one way that you can get out of a contract is just by getting up and leaving. Nobody's keeping you there or hoarding or stopping you. Now, what I want to say with that is, if you do that, if you were to just quit one day out of the blue, didn't say anything to anybody, just told your recruiter you're quitting, or you're withdrawn from your assignment, or XYZ, anything that is outside of normal termination, then what will end up happening is they could charge you an amount for your remaining time. They could charge you compliance fees. So compliance fees are fees that accumulate when you are onboarding as a traveler and doing your training online. So just make sure that you are fully understanding what your contract says, because that's going to keep you in a contract for a long period of time. So if you agree to 13 weeks, that is a time frame you agree to. You can't stop at 10 weeks unless, you have a real pertinent reason. You talk to the right people and why you want to leave, and they understand and let you go or release you. And even things like the type of unit and things like that, a lot of times as travelers, you're going in blindsided. You don't know what it's going to be like. So what I encourage is, sometimes And maybe we as travelers should start doing this, is asking to see the unit or going and visiting and seeing what environment we're going to be working at, because that might make all the difference. Because once you sign that contract, you might have never seen that place, but if you go there, you signed on for that time and they expect you to show up. So make sure that you know what you're showing up to. So I want to talk to you guys about experience in travel nursing. A lot of times facilities will tell you that they want about 1 to 2 years in a certain specialty for experience. Now, my caveat to that is experience is not always met in years. And what I mean by that is when somebody has 5-10 years experience does not mean that they're going to be a great travel nurse, because travel nursing is really about flexibility. So what I urge for you is to really think about, how has the experience affected me? What have I learned from it? Am I a resource to others? And do I really help my patient get better? What I mean by that is, are you the sole person within the care team that is really bringing that care to them? And that's hard to answer sometimes because we feel like, okay, well, we're a care team model, but you need to make sure that you're able to start your lines, go ahead and help out the physicians, communicate between different specialties, communicate with different team members, because all of that's going to be very different for every facility that you go to. And I want you guys to really understand that, is that travel nursing is about being a diverse person and being flexible, and less about being the most skilled person. Because when you go to a new facility, they're not going to give you the craziest levels of care. You're not always going to get ECMO, you're not always going to get CRT, you're not always going to be doing the rapid infuser, because you're there to help them out where they have gaps. And what I would also say about that too is, for example, when I went to my second facility to travel nurse, they didn't want me to be in the ICU because I wanted to do a critical care float pool traveler, which is pretty intense. So I'd be floating to all the different ICUs. They had a SICU, MICU, cancer ICU, cardiovascular ICU. So just a full grasp on ICU care. But I'd only worked at a small generalized hospital and generalized ICU. What I would say though is that at that ICU, we saw everything during COVID, and I'm sure you guys can understand there was everything coming through those doors. I had balloon pump patients, I had an Impella patient, CRT every single week, most times a week, ventilators, just a full grasp of ICU care. So I was able to take care of a lot of different types of patients. And so I remember they told my recruiter, hey, we don't want him, what do you want to do PCU? And I told them, I said, hey, let me just have a conversation with the manager who's in charge of the float pool. When I had talked with them and just told them my experience, told them what I had done for my patients, how I incorporated myself into the care team, and that drastically changed their answer. Within 15 minutes, they called my recruiter and gave me the offer for that job. And the difference there was I really understood that experience is not equal time. Experience is what you take away from something. And that's the biggest difference there. So just because you come from a level 1 trauma center, just because you have 10 years of experience doesn't mean you're gonna be the greatest ICU travel nurse or any specialty travel nurse. But what you did at that time there, what you took away from that time and how you understand the care that you deliver will make all the difference when you're trying to tell them about your experience.